If your eyes are feeling like a desert, constantly dry and uncomfortable, relax because relief is finally in sight. For millions suffering from dry eye syndrome, this video will explore the latest diagnostic techniques and unveil the most effective dry eye treatments available, from artificial tears and the best eye drops for dry eyes to cutting-edge dry eye therapies. Get ready to say goodbye to that irritating grittiness and embrace a world of refreshed vision. Whether you're a long-time dry eye patient or just beginning to experience the discomfort, this comprehensive guide will equip you with the knowledge to take control of your eye health. Stay tuned. Welcome to today's video. I'm Dr. Aisha Bed. Thanks for tuning into our channel. In the second video about dry eyes, we will explore different diagnostic tests and procedures, treatments and medications available so you can finally be relieved from this unfavorable condition. Let's get started. So what are some of the different tests and procedures that may be used during the comprehensive eye exam to find out the causes of dry eyes? The most important one is when you come in, we discuss the history in detail. We want to know what are the medications or any systemic health issues that you may be suffering from. Once we use our slit lamp or microscopes to look at your tear films, we'll be checking the health of your eyelids, since they're really important to produce the healthy oil layer. Lacrimal gland can be hard to see. However, we can see the function of lacrimal gland by actually putting some yellow and green drops into the eye. So the green drop highlights the dead irritated skin on the conjunctiva, which is the white part of the eye. If I see a Christmas tree, that means the dry eye is very severe. We usually grade that staining from grade 1 to being mild, grade 4 being severe, and all I see is green on a grade 4. Orange one, or fluorescein stain, is more useful on the clear part of the eye called cornea. If I use this drop on a patient and the whole thing is staining positive, that means my patient has severe dry eyes. So we can grade our patients from grade 1 to grade 4. We use state-of-the-art technology to take pictures of our patients' eyes so we can discuss the stages of disease and treatment options. Two more procedures that we do to check the patient's tear quality and quantity is inflammatory and tear osmolarity. Inflammatory just looks like a pregnancy test that we use in the eyes to make sure that there is not a lot of MMP9 amount in the tears. It literally looks like a lab test, except that it's done on your tears. The number one is artificial tears. Most of the patients reach out for those over-the-counter lubricating eye drops that can help relieve dry eye symptoms. The most important thing for you to understand is that get the artificial tears that are non-preserved, such as these unit vials. If you're getting a bottle, try not to use them more than 4 times a day because you're actually introducing more preservatives in your eyes. So instead of helping your eyes feel better, you're actually putting more chemicals in your eyes. Second most important one is the lifestyle adjustments, making sure that you're taking regular breaks from screen time, looking away 20-20-20 every 20 minutes, using humidifiers and staying hydrated, making sure that you're using sunglasses when you're out and about. Sunglasses prevent the direct exposure to not only sun, but also air conditioning and direct fan. If your eyes are dry, try to limit the exposure to the sun and air conditioning and heating, because direct exposure to the wind, heating, and air conditioning can cause your tears to evaporate. Third is actually prescription eye drops or spray for the treatment of dry eyes. The most common ones used are cyclosporin or Restasis, lifitegrast or Xiidra, or a spray called Cervia. Anti-inflammatory medications can also be prescribed, such as Lodomax, to help with the contributing factors. Number 4 is warm compresses and lid hygiene. Regularly applying warm compresses and cleaning the lids can help with meibomian gland dysfunction. An important in-office treatment that we do in our office is called tear care. Tear care literally heats up your meibomian glands to help us turn those solidified glands into more liquid. That way we can clean and clear out those blocked glands so you can produce your own healthy tear film. Once we focus on the treatment of tear quality, improving the quantity of tears within your eyes can be very easy. We use something called punctal plugs. Those are small devices inserted into the tear ducts to reduce tear drainage and retain moisture on the eye surface. It's very easy. So once the tear quality is good, we can plug the drainage so I can improve the quantity of those tears in the eyes. I would never recommend that we do the punctal plugs as a first line of treatment, however, because you don't want to plug in the dirty thing. Let's first make sure that the quality of your tears is the best before we plug it in and improve the quantity of your tears. Last but not least is the supplements. Dietary supplements or foods rich in omega-3 fatty acids can improve tear quality. Addressing the underlying cause is crucial for effective management of dry eyes. Consulting an eye care professional for the comprehensive evaluation and personalized treatment plan is highly recommended. At TSO, we treat our patients with tear care. Your tears are made up of 3 layers: mucus, water, and oil. 86% of dry eye patients are due to meibomian gland dysfunction. The meibomian glands in the eyelids produce the lipid or oil layer of tear film. The lipid layer stabilizes the aqueous or water layer of the tear film, slowing down the evaporation of tears. Insufficient lipid layers leads to evaporative dry eyes. When we blink our eyelids, express the lipid out of the meibomian gland and the oil is drawn out the tear film. MGD occurs when the glands become inflamed and the lipid turns from a clear oil to a thick butter-like consistency. Chronic inflammation of the glands not only thickens the oil, making it more difficult to express out of the glands, but it can cause the glands to shrink and atrophy and die. Intervention with treatments such as tear care can help. Tear care supplies sustained localized heat to eyelids to aid in the treatment of meibomian gland dysfunction. Dry eye and blepharitis. This softens the hardened oil that clogged the meibomian glands of the eyelid. Afterwards, pressure is applied to the eyelid to express the glands and squeeze out the oils. This has been shown to improve dry eye symptoms in subjects with meibomian gland dysfunction, compared to treatment with artificial tears alone. The studies for tear care system demonstrated that it is safe and effective in treating the signs and symptoms of dry eye disease. The studies for tear care system demonstrated that it is safe and effective in treating the signs and symptoms of dry eye disease. Significant improvement in signs and symptoms were seen in 100% of subjects within 1 week, and 84% of subjects experienced meaningful symptomatic relief. Tear care is not currently covered by insurance. However, Sight Science will provide $50 to $100 rebate to patients, which helps you take care of your tears. This treatment option is likely more cost-effective than other dry eye products and treats the root cause of your dry eyes, which can help bring function back to your glands. We know that based on the meibomian gland dysfunction, there is no treatment that would actually work as well as the tear cares. We've taken an in-depth look at the diagnostic journey and treatment landscape for dry eyes, a condition that can significantly impact one's quality of life. If you or someone you know is struggling with dry eyes, remember, relief is within reach. Don't let this condition hold you back any longer. Subscribe to this channel and turn on notifications to stay updated on the latest in eye health and dry eye management. If you found this video helpful, give it a thumbs up and share it with your friends and family who might also be seeking solutions for dry eye struggles. Thank you for watching.